Hello, I'm Dr. Vasella. I thank you for coming to the Wilmington Clinic. I just want to take a few minutes to explain a little bit about the Wilmington Clinic. The Wilmington Clinic was started by Dr. Kenneth Yoakum in South St. Louis in the early 1950s, and he used a very unique methodology within the chiropractic profession. I personally came into the Wilmington Clinic in 1977, and then we moved to our new location here in 2007. And the Wilmington Clinic specializes in a variety of different chiropractic procedures. Many times people with chiropractic, they have a preconceived idea about chiropractors because they usually think about chiropractors moving some type of joint, sometimes there's a crack or a pop with it, to get some type of relief. And chiropractic has been around since 1895, but what uniquely happened in 1935, a fellow chiropractor, Dr. Logan, started a school here locally using a non-thrusting or non-cracking procedure. It was called Logan Basic Technique. And during that era, many other procedures were starting to become popular. And in this clinic here, we use a procedure that's commonly referred to as trigger point therapy or receptor tonus technique, which is a non-thrusting type of adjustment. The adjustment itself is for the goal to return movement. Muscles move bones, bones do not move muscles. No matter how you cut the pie, the reality is there's always a muscular component to a pain pattern. The chiropractic profession has been enlarging their entire approach. It's no different from a medical profession. Chiropractors and medical doctors get the same formal education. We all learn how to diagnose the body, all different things that could potentially be wrong with the body, but the reality is the medical doctor learns how to treat, and I use in quotations, everything with medicine, surgery, and injections. And quite frankly, there's a time and a place that's absolutely necessary to have that kind of approach. The chiropractic profession learns how to treat a lot of things with their hands. The word chiropractic does not mean cracked joints or movement of bones, etc. It means done by hand. And within the chiropractic profession, we do learn a variety of different methods on using our hands. We also learn how to treat the body with physical modalities. Some of these physical modalities you've heard of before, hot or cold. We use, down at this clinic, we also use traction, spinal decompression. The newest thing on the market is cold laser. It has a lot of good reform for pain control. We also use ultrasound and diathermy and a variety of other different secondary things. We also use some acupuncture when it's important. Acupressure is the main form of our treatments that are down here that we use by hand. The reason why we use so much acupressure is because, once again, muscles move the bones in the joints don't move the muscles. So as you see me move the bones of my hand and my wrist, if you can see, my forearm muscles are moving that. That particular fact is true for every single joint in the body. In the 1940s, we, quote, discovered trigger points within the tissue, and really what they were areas that would knot up where the nerves and blood vessels would enter the muscle at specific locations. And as they became overactive, they would contract the musculature, which would limit the joint, and then you would have pain from the musculature as well as the joint. Because nerves, pain is a pinched nerve. A lot of times people say, well, my doctor says I have a pinched nerve in my neck, or I have a pinched nerve in my back. The fact is, every type of pain that you feel in your body, there's a nerve being irritated in one fashion or another. Our approach is muscular because the first place any type of problem develops, it develops from a muscular side of the equation. Then if it persists long enough, the mechanical joint aspect becomes issue, and there are nerves in there that produce pain. And then if that lasts long enough, the discs themselves can become an issue, and that's called nerve root type of pain. And all those three can be managed conservatively. Many times you may need to have some surgery, you may need to have some injection, you may need to use some medicine. That is something we go through. We'll be going through some history when I talk to you. I'll be doing a diagnostic workup on you to make sure you have what I hope you have, and then kind of recommend a treatment plan to try to get you out of the pickle you're in as fast as I can for you. So the reality is we are going to be working under your conditions, what's most comfortable for you. Pressure-wise, it can be very gentle on some folks. Some folks can handle a little deeper pressure. Everything is tailored to you. I actually work for you. You and I, though, are working together as a team for your situation that you're in. I'm going to do everything I can to try to help you out with the pain that you have at this time. Thank you.